So this is a very, very complex patient. So you can multiple myeloma, heart failure, was put on a melanoma pump. He had, chronic kidney disease. He had adrenal. That's about 4 or 5 different specialists right there, okay, who may come in and provide different types of treatments. And a patient with this type of a presentation, hospitalized frequently, his condition was declining.
This patient's name is EJ, and he's a 66-year-old male who was diagnosed about 2 years ago with non-ischemic cardiomyopathy and heart failure. He's also had a history of atrial fibrillation, a stroke, and multiple myeloma. And so initially I'd been seen at our clinic wanting a more integrative approach and having shortness of breath with mild exertion, requiring diuretics at that time, and having more frequent hospitalizations for fluid overload and heart failure, and eventually was put on a milrinone infusion, which he went home on outpatient, which helps the contraction of the heart. It's not intended to be long-term outpatient, or it can have negative effects at that point. And so with us, he'd done the nutritional detox, he did the meal plan, he finally fully committed to the program, and he told us he felt like a different man. Even though he's 66, he now felt like he was 45. He wasn't even using his diuretics every day of the week at this point, and we had made a realization that we needed to upgrade his regular dual chamber implantable defibrillator to the resynchronization therapy device, because he had similar to a left bundle branch block morphology, and by synchronizing the heart, that can improve cardiac output. And we wanted to see if that would improve some signs we saw of multi-organ dysfunction with the thyroid, adrenal glands, kidneys, and liver. And his blood work was making good improvement in all those areas. So we're still working with him, but our goal is to wean him off this milrinone infusion that he's on at home and continue with the plant-based.
So here you have someone with life-threatening heart failure on a milrinone pump. For those of you who are not familiar, milrinone is a medication that's given intravenously and is given to patients with severe heart failure. Typically, patients who are near on their last leg for heart function. And it's oftentimes the last treatment just before they go for transplant or mechanical assist device for the heart. So he was at this level of treatment for his heart failure, and there was other organ dysfunction, as you mentioned, the kidney, adrenal glands, liver. You can almost argue that here's someone who's on the threshold of what we call cardiogenic shock. In other words, his heart is so weak, it's not perfusing or circulating the blood adequately to the different organs in the body for them to function normally. And so you have a situation where the central part being the heart, but also the chronic illness itself could be, you have a primary chronic adrenal gland problem, you have a primary chronic liver problem. So you have multiple organs that are failing independent of the heart failure. Was it early signs of multiple myeloma? Did they diagnose him with it, or they just had some?
That's been diagnosed. He actually went through a treatment, I believe it's Revlimid in the past, but his specialist said was staying pretty stable. So we've been watching the pancytopenia, the platelet count, the red blood cells, white blood cells, and just monitoring that.
So pancytopenia means it's basically across the board. It's pan, cyto, cells, penia, small or decrease in number. So he had a decrease in number of white cells and platelets and red cells. So he's anemic, low white count, and multiple myeloma is dysplastic disorder, can have what we call a systemic inflammatory effect on the body. So the body's immune system was in part probably attacking itself. That may have contributed to the other organs dysfunction. So here's somebody with severe chronic illnesses that would typically require the work of about 4 or 5 specialists. And you can imagine a list of treatments and medications he would be on. But what do? We put him on a targeted nutritional regimen, which cuts at the core of all of those illnesses. Now, there were other things we do. Now, this gets at the heart of integrative medicine. So we did not ignore the nutrition despite the complexity of his illness. Oftentimes, doctors see a patient like this says, well, nutrition has no role. He's too sick. Let's fix this up first and we'll deal with that later. No, nutrition is first and foremost. And so that's what we always do here, nutrition. Now, the diet varies depending on what the illness is and how aggressive we are. So we put them on a specific nutritional regimen based on food classifications that was target for his illness. Now, we also did not ignore the allopathic treatment. So we recommended for what's called cardiac resynchronization. Oftentimes when the heart is weak and you have an abnormal conduction system, the electrical signals from the upper to the lower chamber is abnormal such that the lower chamber on the right will squeeze before the lower chamber on the left. And so instead of the two ventricles squeezing like this, they'll squeeze out of synchrony. And so that creates an abnormal circulation or inefficient circulation, which can worsen heart failure. So by just simply synchronizing those two, you can give a lot of benefit for the heart and improve circulation. So that was something that we added to the list of things we did. So we're not so dogmatic to say, well, this is only nutrition. And we're not so dogmatic to say only resynchronization. We put the two together and they have a synergistic effect. We left them on the millinone because there were other things we wanted to do to let his body heal. But we know that you don't want patients on millinone for a long period of time. What do you know about millinone? There was a study, I don't know if you remember the study done on patients. I think Pfizer came out with an oral form of millinone. And what did they find in that study? You remember?
I think after 6 months, outpatient increases risk of death from cardiovascular causes because it can increase ventricular arrhythmias and cause sudden death.
So millinone kills after a certain period of time. So we know the pill kills, the IV kills. So we can't leave him on this drug for too long. Again, that integrative approach makes a difference. So with the nutrition, and even before the resynchronization therapy, he was getting better with just nutrition. Target supplementation. We did some medication weaning in the interim to a certain extent. Polypharmacy can have an adverse effect. Too much diuretics, too many other medications can affect other organs. Plus, we put on supplements for the adrenal gland. So we had a multifaceted approach with this patient and saw the improvement. And he's getting much better. He's feeling better. We've reduced the medication. And the next phase is to start weaning the millinone. And we're going to do that in an organized fashion with close follow-up. And again, we don't do these things in a haphazard manner. These patients see us weekly, sometimes every other day. Some patients are seeing us 5 days a week while we monitor their condition. And we also wean their medication. So again, this integrative approach can be very effective, very powerful, but it's done in a controlled setting and it's done in a very direct, intentional way. So excellent. So we look forward to getting follow-up on this patient with his complex disease, but he's already on the course for improvement. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.